at one patient in particular. She's in room 1521, Florence Roberts, age 19. She came in about 3 weeks ago with a really serious case of pneumonia. She hasn't shown much improvement, so we're going to see what we can do for her today. Okay, I'll let you try out some things as well. Okay, Chelsea, so today we have our patient, Florence Roberts. She's been with us for a couple weeks. She was a really bad case of pneumonia. So we're gonna take a look right here and just see how she's been doing with her breathing. Can I have you sit up for me? Okay, deep breath in and out. Breathe in and out. Okay, now let's have you try and look. Breathe for me and out. Breathe for me. You okay?
The air in here is awful.
What do we do for her? I wonder what my favorite nurse, Florence Nightingale, would do.
Lauren, how are you feeling today?
Not very well. This
Okay.
air in here is just...
Ugh, let me take a look. Can you breathe in for me? Breathe in again. Ugh. I know what the problem is. You need fresh air. These windows, they need to be open. The first thing you always want to do in a patient room is make sure that the air circulating is fresh. The suffocating air is not good for patients. It just keeps going right back into their lungs and making them even sicker. Always make sure the windows are open.
I feel much better now.
Hey Lauren, how are you feeling today?
I'm good. I just have a little bit of a headache though.
Are you okay though?
Yeah, I'm doing great.
Did you hear something at the door? Hey Lauren, what's up? How are you feeling? What do we do with this? Hold up! What did Florence do? That was fabulous.
What is this? You know what? We need quiet. I'm sorry, but you're gonna have to leave. You need to leave. Your friend, she's feeling better, but in order for someone to get all better, they need to have quiet. Without quiet, so many bad things could happen, and it's just not a safe environment.
Lauren, how are you feeling today?
Feel okay.
Yeah? Can you sit up? We're just going to do a quick assess just to see how you're doing. See if your breathing's been getting better. Can I get you to breathe in? Can I get you to breathe out? Okay. Is there something else going on?
My arm has been hurting a lot lately.
Can I take a look? Chelsea, what does that look like to you? This looks like MRSA. Should we bandage it? How would I bandage that? Well, I wonder what Florence Nightingale would do.
Proper sanitation is a must for dealing with all kinds of diseases, especially MRSA. See, check out my gloves and my mask. This disease is very contagious, and it's important that you always wear this. Besides being sanitized while you're dealing with a patient, the room itself needs to be sanitized. Always make sure that there's no dust around anything, and that the walls are clean as well. MRSA can be contracted by bacteria and touching and dirtiness. One of the problems is hospital has carpet. That's the worst kind of floor you can have. In order to keep a hospital clean, you must always make sure that not just the patient is clean, but the surrounding area.
Sorry we had to move you. How are you feeling today?
I'm doing better. Is
Yeah?
your arm any better? I don't really know.
It looks like it's doing a little bit better, but yeah, it looks like it's doing good. Can I also get you listen really quick? Sounds like your lungs have been clearing up. Can you just lean this way a little bit more?
It's really difficult.
Like that. Like that. That's good. Can you breathe in? Breathe out. Your lungs sound a little weird, but they sound good. Is your new room uncomfortable?
No, it's just been really hard to get out of bed all the time with it being so high off the ground. It really kind of stinks when you have to go to the bathroom in the middle of the night. Just saying.
What should we do for her? I'm wondering what Florence Nightingale would do in this situation.
Oh, well, this is why you aren't getting any better. Look at the height of this bed. One thing you should always do in treating a patient is that the bed should never be higher than the sofa. Example A, here's the sofa, and here's the bed. The patient would have a hard time getting out of bed and can possibly injure themselves more. Also, it's harder for the nurse or doctor to look after the patient. One more thing that should always be considered with bed is the bedding. These sheets should always be changed every other day, or definitely when a new patient comes in. That's the fastest way to spread diseases is dirty sheets. You never want to have that in a hospital.
Florence, what's going on? Why are you throwing up like this?
My stomach hurts.
What have you eaten today?
I don't know. The nurses just kept bringing me food. I think I had like 2 breakfasts, like 3 lunches, and it's almost dinner time.
Oh my goodness. What would we do in this situation? I wonder what Florence would have done.
In order to keep a patient's dietary needs met, it's important to document what they've been eating and at what time, so they do not overfeed or underfeed. Besides documenting everything, it's important to observe the patient and see how they're taking their food in and if they're keeping it down. Certain ailments require certain dietary needs, and it's very important to always keep these in track because it's beneficial to the patient's health.
I'm glad it was really beneficial for you today. But just remember, in any situation that you're not sure what to do, think, what would Florence do?
Wrote her book a really long time ago. Her thoughts are still used throughout the hospitals today.
Even things as simple as opening a window or keeping the noise level down can have a huge impact on the healing of a patient.
It's important to keep your patient personal and be able to be open with communication and also have them at the same level as you so you can take the proper care of them, whether that be keeping them at a lower bed or changing the sheets or just being able to communicate.
Sanitation is still very important today, even though with all the modern technology that we now have, bacteria easily spread in dirty environments.
It's always important to wash